Hello, my name is Craig Rodriguez and I'm an insurance agent in Orlando, Florida. And we've been talking about the Patient Protection and Affordable Care Act, otherwise known as ObamaCare. And I've been trying to explain to people what's going on with ObamaCare and what it's really going to do to us in the long run. And what I often say to people is, if I could show you exactly what it would do, not tell you, but show you exactly what it would do, would you be interested? Well, it turns out that in 2006, Massachusetts passed almost this exact same piece of legislation. It had all of the major components that we're told are going to bring healthcare costs down. They mandated that individuals buy coverage or pay a penalty. They mandated that businesses provide coverage or pay a penalty. They said that they were going to cover the poor, thereby increasing the number of insureds, which of course was going to bring costs down because we didn't have uninsureds. They also said that this was going to bring the young, healthy people into the pool, so that's going to help pay for the sicker people because the younger people that don't generate claims would be in the pool. They also mandated the 90% medical loss ratio. We're going to talk about that in the next issue and how that's going to drive costs through the roof, but not in this segment. So with all of these pieces in place, would it not make sense that we could just look at Massachusetts and that would show us exactly what's going to happen with our healthcare system? Well, when we take a look at Massachusetts today, what we find is they have the highest rates in the country. Not the lowest, but the highest. The insurance companies had to ask for about a 30% rate increase this year and was denied by the state to get that rate increase, and they're currently in a battle over that because they've been losing money. Then we take a look and we find out that the state has had to reduce benefits on over 30,000 people that were in their poor funded plan because they could not afford to cover all of their benefits. Right now the state is estimated to lose about $400 million or have 85% more expenses than what they originally projected for their state funded plan. The thing that's really relevant though is I have a friend that writes business in Massachusetts and he says, Craig, let me tell you about my group. In March of 2008, to cover a single employee on that plan cost $440 a month. In March of 2009, they got the renewal. To cover a single employee went to $770 a month in premium. In March of 2010, when they got the renewal, that went to $1,100 a month for a single employee, $3,900 a month family rate, $46,000 a year to cover a family. That is outrageous. Now, when we continue to look at the state, what we find is the businesses are beginning to drop the coverage because they cannot afford it. They're saying that they'd rather pay the penalty than to try to provide the coverage. Obamacare is going to make health insurance completely unaffordable in America. I want you to know the truth and why it matters. Thank you.